This is a case presentation of a subaxial cervical spine trauma patient. My name is John Kerner. I'll be presenting this case in conjunction with Alex Vaccaro. So this is a 25-year-old male who fell approximately 15 feet, landing on his head and sustained these injuries. On the left is his CAT scan sagittal images, which show a C5 vertebral body fracture. There's a coronal split with facet subluxation and ligamentous injury at C5-6. Sagittal T2 MRI again shows the C5 vertebral body fracture with cord compression at the C5-6 level. There's also an area of myelomalacia in the cord at the C6 level. It's also demonstrated ligamentous injury to the facets at C5-6 bilaterally. Sagittal stir images demonstrate the extent of the ligamentous injury posteriorly. He had also sustained an incomplete spinal cord injury. In using the AO spine subaxial classification system, this would be classified as a C5-6 B2 injury, which is a posterior tension band injury, as well as an A2 fracture, which is a split or coronal split fracture involving both end plates but not the posterior wall. In addition to that, he had an incomplete spinal cord injury. So due to his instability from the injury, in addition to the neurologic deficit with ongoing cord compression, he was brought to the operating room urgently. This was done in stages. First, he underwent an anterior cervical corpectomy at C5. This was done with cadaver allograft and a plate. Here are the intraoperative x-rays showing the plate and graft across C5 in the lateral and AP views. He was then brought back to the operating room for a posterior procedure in order to further decompress and stabilize the spine. And this was done from C3 to C7 with lateral mass and pedicle screws. These are the intraoperative images, the AP views, demonstrating the lateral mass screws and pedicle screws at C7. And these are the postoperative x-rays at about 3 weeks after surgery. He had very good recovery of his neurologic deficit. Here you can see the x-rays with AP and lateral views demonstrating the anterior plate and graft as well as the posterior lateral mass and pedicle screws. These are subsequent films at about 6 months which demonstrate a corporation of the graft anteriorly and stable position of all the instrumentation. He remained asymptomatic at this time with full recovery of his neurologic injury.